The top foods to avoid after bariatric surgery. Hi, this is Dr. Huguet with MIS, the Weight Loss Institute in St. Pete, Florida. With bariatric surgery, there's often dietary changes that you will go through. You go through dietary changes before surgery and after surgery. After surgery, there's what we consider the immediate postoperative period, and that would be the dietary changes you go through right after surgery up until about the 6-week mark. A lot of the information that we cover is in a manual that patients will receive, and they meet with the dietitians a minimum of 2 or 3 times to really review dietary changes required. For the most part, patients go through phases after they have their weight loss surgery where they start out with liquids. And the reason we start out patients on liquids is to protect their pouch or sleeve after they've had weight loss surgery. We want patients to protect the staple line from the operation to prevent leakage or damage. So for the first 2 weeks, patients will be on a liquid diet, and patients often say, well, I can't do that. Well, the good news is after weight loss surgery, you won't have much of an appetite. And so with that, you really don't want to eat more than just liquids typically. And the reason is that your body is adjusting to the new anatomy, and so with that, you're not hungry. And we also encourage you to sip small amounts at a time immediately after surgery. The reason we do this is we don't want to overload the anatomy that we've created by drinking too much at once. So we generally recommend an ounce every 30 minutes or so while you're awake to stay hydrated after weight loss surgery. So we have a 2-week period where you drink liquids. Then from there, you move to the next phase, which is a pureed diet. And there's different phases that you go through up to 6 weeks where you go on to soft foods and then on to solid foods. That's the immediate postoperative period for about 6 weeks. That applies for bariatric surgery. After the 6-week mark and more permanently, we do have foods that we prefer that you avoid and foods that we encourage you to eat for arriving at our goal of weight loss. So the more long-term dietary changes would be, we strongly recommend a high-protein diet. The more protein that you can eat, the more fullness you have, and the more you'll improve your positive nitrogen balance, which means that you'll have more of a muscle building effect and overall help with more weight loss. So that's more of a permanent change. We always want you to eat lots of protein. What I generally recommend is if you're looking at a plate, fill your plate up with 70 to 80% of it being a protein source, and then a carbohydrate or vegetable source for the remainder of it. Following that is more of a permanent lifestyle change will help you remain at a healthy weight after weight loss surgery. We prefer you avoid high sugar foods or high fat foods. High sugar foods, depending on the operation that occurs, it can cause problems. With a sleeve gastrectomy, not as much of an issue for dumping syndrome you might hear about, but after, say, a gastric bypass operation, something you can have is called dumping syndrome from high sugar foods, where the sugars get into your intestines too quickly and cause symptoms like your palpitation, shakiness, lightheadedness, and some other things. But we also like you to avoid high fat foods, and the reason for that is we want to not eat calorie-dense foods, because it's still a calorie game that we're playing. We still want you to not take in that many calories, and that's how the weight loss occurs. And so high-fat foods are calorie-dense foods, and so we avoid those to avoid the calories and also the effects on your physiology and your health. We prefer you avoid high-calorie liquids and you eat solid foods. The reason is that high-calorie liquids can move right through your GI tract and give you the calories, but not necessarily give you the fullness feeling, which is what we want to allow you to have durable or persistent weight loss. Some tips that we also recommend is to eat slowly. If you eat very quickly, you'll find that, and these are again more long-term changes, but eating very quickly allows you to eat 2 or 3 times the amount that you could generally eat if you just stopped, slowed down, and ate slowly. The other thing is eat small bites and really chew your food. By doing that, you get full quicker and you eat less. Another important rule to follow is only eat when you're hungry. If you follow that rule, that one simple rule, it'll make a lifetime of change for you. By only eating when you're hungry, more durable weight loss occurs. That one simple teaching is very hard sometimes for patients to comprehend. And I think that's a really important rule to follow. Just by that one rule, patients can have excellent outcomes for the rest of their life. Don't eat for anxiety. Don't eat because of stress. Don't eat because it's time to eat and you have to eat. Eat when you're hungry and you'll do phenomenal. We also encourage more small frequent meals than large infrequent meals. Particularly after bariatric surgery, you usually can't eat as much food, and you should be full after about anywhere between 4 and 6 ounces of food, and that should fill you up. And so we recommend eating the smaller meals rather than twice a day, say 3 or 4 times a day, a smaller meal. We do also prefer that you avoid carbonated drinks as much as possible. The carbonation can cause sometimes a problem with feeling bloated or having an uncomfortable sensation after you've had weight loss surgery. We also recommend you avoid alcohol with any kind of weight loss surgery. One of the issues with alcohol in weight loss surgery is it doesn't get broken down or digested the same way, and it can have dangerous effects after weight loss surgery.